If you did I click on these links? Awesome. If you did, it wouldn't matter if I did it right, because I realized that you have to be a member of these associations, these different nurses associations, to be able to download their code of ethics to read it anyway. I found the downloadable copy somewhere, but it wasn't from these two links. Either way, I don't know, Nevin, are you a member of the American Nurses Association? The ANA?
I don't think I paid for that.
You paid for that yet? Yeah, so either way, the point is that these nursing associations are the ones that set your code of ethics that you go by. They're very similar to the doctor's code of ethics, but they're slightly different because they're for them. Yes? What? You have a question for Natalie? You have a question for you.
That's during my office hours.
Moving on. All right, so obviously, these are some warning signs for, you're going to have some ethical issues. People are emotionally charged.
You guys, he's trying to lecture.
Oh, yeah, and you're probably not picking it up on the recording, are you?
No.
Yeah, so be quiet.
Sorry.
Not that I want most of this on the line anyway, probably.
Too late.
Oh, no, it's everywhere on the internet. Anyway, so yeah, you're going to have a lot of emotionality, a lot of emotions involved in some of these decisions. And again, it's usually some kind of critical care unit. I don't know. Hey, Natalie, you got any good stories about problems where there were some ethical issues, maybe involving family members, DNR, futile care?
No, but what they emphasize in critical care about organ donation, that unless it's on like the organ donation registry online, your family has the right to refuse it even though you're an organ donor and have it listed in like your
Like on your driver's license?
Yeah, apparently.
I did not know that.
If your family's like adamant about it, like no, I don't want to donate those organs. Ultimately, they're the ones that are living and can sue the hospital. So.
Well, there's something new I learned. I knew I asked you for some reason. I just assumed that if you had it on your license.
If the family's really adamant about it, apparently they can fight it and not, because they're asking your family, not you, your dad.
Well, yeah, because you're dead.
So.
That's interesting. Did not know that. That would be one of those confusion about tax categories, right? Anyway, so yeah, these are some things. And by the way, you can help a lot as a nurse alleviating some of these, because people will make bad decisions sometimes because their facts are not correct, right? They did not hear the same thing that the doctor said. And there may be some, things that you can clear up because you've had the education. We talked about that before, right? If you understand what's going on, maybe not. Okay? Now, this ethical decision-making process, I don't know if you have to memorize it for nursing school or not. I have absolutely no idea. You don't have to memorize it for here. But
That's
you'll...
usually, sorry.
Go ahead.
That's usually for the board of ethics in a hospital. That'll go through like that'll go through the whole ethical process.
Yeah. And you probably do this automatically anyway in your head. Because, I mean, really, all this really says is you're looking at all of the factors, right? You're looking at, is this, and when I say you could be the patient, you could be a family member, you could be the healthcare provider, right? You might be on one of those medical ethical boards in a hospital. Looking at the cost versus the benefits, what's in the best interest of everybody involved, short-term, long-term outcomes. If it does go to the medical ethics committee and you're on that committee, you're probably going to be applying previous case studies to it. before, you know, what is the standard, precedent, like in law? You know, that's what judges use to decide some court cases. Ethical boards will do that too, to a certain extent. Make sense? Okay. So, you've probably been wondering this entire time, we're spending an entire week on ethics and morality. What could we possibly ask? Well, these kind of things we can ask. In fact, it's pretty easy to ask questions on a test when we're talking about definitions, especially when there's a whole list of them. Okay, so we're back to spelling words, right? Definitions. You're going to want to know these because these are the principles that all these ethical codes and guidelines are based on. One of them, of course, is autonomy, meaning that the patient and who's ever speaking for the patient, they have a right to decide what they're going to do or not do. Okay? That's like your main thing in ethics. I mean, really. One of the main issues is they're autonomous. They can decide on their own. You know, they don't have to do what's medically best if they don't want to. Okay? Beneficence, as in benefit, right? Obviously, that's pretty straightforward. I mean, you do have a duty to help them decide. Not necessarily help them decide, but at least let them be informed enough where you're not hurting them, of course, and yeah, what it says. It's got a benefit. Not much good if it doesn't benefit them. Non-maleficence. Non-maleficence, that's a good word. As in, don't hurt somebody. Somewhere in my head, I'm seeing this lady with black hair and horns. Why is that? Maleficent, that's her name. Ah, so don't be her. You can't hurt people. Did she hurt people? Yes. She was mean, right? What story was that? Sleeping Beauty? Okay. So she was the queen, the evil queen. Got it.
So guys, keep in mind with these, obviously, like for example, PT, physical therapy, they're going to be harming your patients because they want to get them up and walking. That's because it's for their benefit and there is a reason for that harm. It's not like, okay, you can't hurt a patient just because they're complaining of pain. No, you have to think about is it for their good? Like, they're gonna have to go through some pain, but it's for a reason. It's because you don't want them dying on you later. So.
I worked as a physical therapist for 2 years, and one of our patients had a hip replacement, and he said that it's like, oh, aren't you guys supposed to do no harm? That's a physical therapist is trying to get reflection of his knee. And physical therapist was like, told him that. It's like, well, this is for your benefit, and then he squeezed him.
Yeah, I'm fairly certain what they teach in physical therapy school is if it hurts, do it more and 50 times. Harder and 50 times if it hurts. I'm pretty sure that's what they teach. Because, oh my gosh, physical therapy sucks if you're ever a patient. I swore. I remember I had a really, really bad sprained ankle. And I had a friend of mine who happened to be a doctor in physical therapy, so I went to his place, and oh my gosh, if I did not trust that guy, if we were friends and I trusted him implicitly, I probably would have jumped up, screamed, punched him in the face if I had to get out of there. I thought for sure he was going to bust my ankle in half. I was like, I'm gonna die here. He's gonna snap my ankle in half. But, you know, yeah, that's a good example.
I'm done with my ankle. It's over.
You still have your ankle. Justice. Okay. What do you guys think justice might come into play?
Justice League.
Shut up, quick. Anybody else? Justice League. Fair distribution of healthcare resources. What does that even mean?
using the resources properly, like if one patient has a better chance to survive than another, would you waste all the resources to save the maybe surviving patient rather than one that has a better chance of living?
That's, well, you know what, some of you guys might go into like disaster preparedness kind of stuff. Some of you might actually be a triage nurse and there's a major catastrophe. If you have limited resources, you might be the one deciding what color tag to put on somebody to say, this person is not really a candidate for emergency surgery because they're not gonna make it to the operating room. They're already too far gone. Let's push it on to the next person. So that does happen. There are some circumstances where you simply don't have enough resources. And you do have to decide, you know, who gets them and who doesn't. And sometimes these